this PSA is an important one because of the momentum that a certain phrase is getting from people who are really enjoying the catastrophizing and again that rage posting through the pandemic. And it is the shadow pandemic posting. And I've seen new Instagram accounts pop up and people are getting stuck in. Unaccountable anecdotes are flying around. A couple of data points are being used to prove a point. And it's quite frustrating to see the hijacking of care about mental health from a handful of people who have become adept at working out what's going to get shared around a lot and just poking those nerves regardless of whether they are completely inconsistent with things they've been saying the whole time through the pandemic or not. We want to talk about the shadow pandemic, we want to talk about the mental health challenges. I think a good place to start is on a place where the rage posters and people like me agree, and that is that environments can cause stress for people. And they're going to argue that it's the lockdowns that are causing all of this stress to people, and that's why we're having these horrible outcomes. Now, there's been a couple of data points in the last week or so that have also done the rounds. One about the Lifeline receiving the record number of calls, which it also did in 2020, right before the JobKeeper, JobSeeker help was implemented, because of course, when people aren't financially supported and they start to struggle and everyone is told to just call Lifeline when you have a bad day, the number of calls goes up. But also, the tension in the air in the last couple of weeks has come up about the federal government has stoked this fire, as have the rage posters, that, vaccines might not be our way out of this. And who knows what's going to happen when we get, to 80%. They're not even going to let us out then. Which of course is quite disheartening for people. It's also not true. It's not something they're having a discussion, a nuanced discussion about balancing opening up with case numbers and vaccination rates. But regardless, because we haven't had good supply of vaccines, we're not even close to that. And the federal government appears to be happy to try and divert the attention away from the fact we don't have the high vaccination rates because we haven't had the vaccinations, and start trying to pick a fight with, even if we get there, we don't know what's going to happen with the states, which seems ridiculous because from day one, the answer has been the same. And even though it's quite a boring answer that vaccination rates are our way out, and we're sick of hearing it, and it's been the answer since before there were vaccinations available, the story hasn't changed. We need to get our vaccination rates up and then we can get out. So the environment that you're in can impact people's mental health. The second thing that I think is important is if we take someone in real life who is going through a difficult time and they sit down and they say, hey Josh, I'm having a really tough time. I'm struggling in the pandemic. This could be a young person, it could be an old person, could be a friend, could be a family member. Then that person is struggling with the uncertainty, the anxiety, the just general pressures of the pandemic and lockdowns as well in particular. If I was to sit with that person who says I'm struggling and I go, of course you're struggling. The government doesn't care about you. They're not going to let us out. You're never going to be able to get a job. We're going to be paying for this for the rest of your life and you're never going to have any opportunities. Everyone's depressed. It's killing people all over the place. The lockdowns are doing more damage than the virus ever could. This is the worst thing that's ever happened to us and no one cares and no one's interested. All the experts are idiots and they're all just making stuff up and they don't know what's going on. And so, of course you feel bad. I mean, that is the worst advice, the worst possible conversation advice for someone who is having a tough time that I've ever heard. It is negligent to have conversations like that. If someone's having a tough time, you meet them where they are, you try and understand what's going on, you try and get them the help that they need, and you try and give them some agency and some hope for the future. Then we're talking about children and students and teenage students. Think about what their situation is. We spend their whole life saying, learn, study, go to uni, go to TAFE, do your things, get good at stuff, go out, live your life, get better, become respectable, earn a living, do those things. And all they're seeing is people screaming and yelling at experts who've done that and disrespecting them constantly, disrespecting the opportunities that may or may not come up through those times, yelling at people who have jobs even as a fun side thing that a lot of rage posting hype mongers are doing. And they're sitting there going, well, why am I studying hard to go out into the world with expertise or with a view to develop expertise only to have angry people yell at me, only to have expertise overtaken in importance or in attention by noise, by loud people, by people who didn't care about any of this stuff 6 months ago. That's taking away agency for those people. It's taking away hope from those kids. If we say, listen, we've got vaccination rates to get through and we're going to get there and then we're going to get out, and they go, okay, and you'll be able to get out again and see your friends and party and go to the pub and do all these fun things that you know you're looking forward to. And in the meantime, we're really lucky that we've got these digital tools to keep you on track and help you with the learning. And hopefully we create a little bit of extra space in their day so they're not pressured to, you know, overdo it at school and things like that as well. We let them know that like there'll be support around them. That's important. That's an important way to have a conversation with people. You wouldn't have that conversation face to face with someone. So I ask why you would post things like that for those people to see. Why you would constantly post that everything's ruined, that this isn't going to happen, that these things that work don't work, that don't listen to the experts, that don't do these things we've been told to do, protest, you know, the government doesn't care. It is casting the shadow. It is casting the shadow for these people, for these kids, for other people that are vulnerable, for people that have anxiety, for people that are struggling in general. The sky is falling. The attitude of hopelessness, the experts not knowing what's going on, the constant attack on the institutions that look after us as well as make these decisions, is not to say that we shouldn't have accountable discussions about it and we shouldn't pay attention to those things and that there can't be ways to improve them. I've been saying the whole time, I think we need improved supports for people while we're in lockdown. But the screaming and yelling and the catastrophizing is a huge contributor to the shadow that is causing challenges for people. I'm not saying that if you have been frustrated that you're necessarily contributing to the suffering of others. What I am saying is, if the thing you're posting is not the way you would talk to someone in their absolute worst, if the thing that you're posting is not the advice you would give that 16-year-old child who is struggling, you wouldn't sit there and say, it's hopeless, we're never getting out, this isn't going to work, vaccines are rubbish, there's no way forward, government's lying to you, experts are idiots, there's no hope, we're going to be paying this for the rest of your life and your grandkids' lives. If going on about that, if catastrophizing that is not how you would deal with them in the moment when they came to you for help, don't post it. Don't put it on the internet. Don't let it whip around. Don't share it. And while we're on the subject of sharing stuff, and I know this is a bit longer and I apologize, but there's just a bit to cover here because it's really important that we move away from tweets that sound good from people who don't care about you to people who take the time to go through it properly. I have seen tweets whipping around from people or quotes on Instagram, comparison, we shouldn't compare with anyone because it's pointless. From some prominent accounts that have got a lot of attention through this time, people that have built a profile off the back of screaming and yelling about what's going on. Don't compare, comparisons are silly, you can suffer without it. Absolutely. Man, I've been talking about this for ages, I've spoken about it a number of times. But if you just scroll down that person's account, there's comparing people who are working to people who aren't working. There's comparing the people who are doing the work to protect people versus people who are struggling. There's comparisons between Australia and North Korea. You don't even have to go far down on these people's accounts to be like, this person doesn't even do what they say they're doing. They're just trying to poke things at the zeitgeist, poke things at what's in the news, poke things at headlines to get traction. So people go, yeah, that seems about right, I'll share it around. But this person or these people, they're not here for you. They're here for attention. They're here to ride heightened emotions and keep them high. Heightened emotions and feelings of hopelessness, they sell really well. Every day of my life, there's been a headline on the paper. Every single day, something's gone on. And the lack of self-awareness from some of these rage posters to claim that they care about this stuff now because of the pandemic and not have the awareness to realize that if we were in a different situation where thousands of people were dying every day, that they wouldn't be screaming and yelling about that, saying, the government's let us down, they're trying to kill you, it's a mess, and just pick the other thing that gets attention, is wild to me. Doctors don't have that luxury. They're working every day based on things that they're accountable for in the long term. They're on the hook. They're using knowledge they've developed over a really long period of time. And we want kids to aspire to that. We want to give them agency in a direction forward that expertise matters. Knowing what you're talking about matters. Volume doesn't matter. Time in matters. Care matters. Being a cooler heads prevailing matters. that just rage doesn't whip around as easily as rational, sensible community care does, because that's what really matters. So as we sort of get to the end here, I'll bring it all together. First of all, I want to say, like, the mental health in Victoria has been taken seriously a long time, and we actually had a Royal Commission into the mental health system which started in 2019, and the Royal Commissions take a while, so the reports came through early 2021. But this is something that has been on the radar a long time. There are people who have been working in this space and doing work in this space for a very long time. This isn't a new thing, that mental health challenges are very real and they can have very tragic consequences, and we need good comprehensive supports for these. I've spoken about it a lot, I won't bore everyone with it now. But the shadow pandemic that came up from an interview with Dr. Pat McGorry. Dr. Pat McGorry is a brilliant guy who does wonderful work at an organisation called Origin. Wonderful guy, long time in, like decades and decades in. I'm catching up with him in a couple of weeks. Hopefully we're allowed out to have a coffee, and I look forward to that as well. Wonderful guy. And in this interview, mentioned that there's a challenge and said shadow pandemic. So there was this interview. I got a copy of it early. I said to my friend who sent me the copy, I said, mate, this is going to kick off the people who are looking for reasons to scream and yell are going to pick this up and run with this one line. And that's what happened. Now, I don't like to post about stuff that hasn't happened yet because I don't think it's worth it. The sky is falling, doesn't help anybody. So as an aside, one way to check whether it's worth getting annoyed at something is this happening, or is someone saying this might happen in the future? Don't share stuff that's a this might happen in the future. Just don't. What's the point? Like, who's that helping? If it happens, we'll deal with it when it happens. If it doesn't, you didn't waste anyone's time hyping them up about it. But Pat, wonderful guy. And so I was pretty certain, knowing what he's about, that the direction it's been taken in was not what he intended for it to be taken in. And not to put words in his mouth, I'll just read the actual words. Here we go. This is from Pat McGorry. In wartime and crisis, the public morale needs to be maintained. Confidence in the leadership really matters. The message has to be a mix of competency, decisiveness, but also empathy, and I think that last one is one we need to work on. People are losing hope because of the confusion about the path out. They are looking at the Northern Hemisphere where there are high vaccination rates and high cases, but they are opening up with fewer deaths. I think the lockdowns are necessary until we get to that 80% point, but you can't pursue the zero case strategy after that point. If you're going to move the goalposts, you've got to have a good reason, and the children issue may be one. COVID zero is a good goal until you get those vaccinations right up. Unfortunately, some people will fan those fears as we try to make that transition. No one can tolerate the lockdowns extending months and years into the future. Now, does that sound like someone who's saying we shouldn't be locked down? Are you sharing that 1-2-word quote, the shadow pandemic, and saying, see, lockdowns don't work? The person who coined shadow pandemic is saying we need the lockdowns. We need 80% vaccination rates. It's saying not to constantly attack the leadership. We need to maintain public morale. We need to look after one another. We need to keep the tone calm and not chaotic. We need to not lean into the loud catastrophizing, attention-seeking, fear-mongering, screaming and yelling people on the internet who are just trying to get your attention and just trying to get the shares and just trying to get the likes and just trying to take your positive emotional response to tragic things and get you to empathize in a way that benefits them but doesn't really benefit the people you're seeking to help. If you wouldn't say it to the person who's sitting in front of you having a really tough time, if you wouldn't catastrophize to someone who's struggling, don't do it on the internet. Don't share it around. There's no point stoking confusion. Confusion muddies the way out. It takes agency and hope away from people who are struggling, from young people, from teenagers, from vulnerable populations, from remote communities, from people who are already suffering from anxiety and depression and who are already stressed out, from people who are already having a tough time because of all the things going on around the world right now. We can do better than that. We need to do better than that. Don't cast a bigger shadow than's already been cast. The way out of a shadow pandemic is not casting a bigger shadow. It's shedding more light. It's providing a way out. It's light at the end of the tunnel, not leaving people stuck in the tunnel. It's advocating for better assistance for people in need, and it's keeping people positive, full of hope, full of agency, and maintaining confidence in the experts and maintaining confidence in the strategy that we've had since day one, which is moving slowly and frustrating everybody, but it's moving. I'm sorry this is a long one. I'm sorry how long this has gone. It's just really hard to see the attention going to people that just want to scream and yell. That if you just look back a month, a year, whatever, on what they've been saying, it's completely contradictory to the things they're talking about today. And it's so clear that they're just trying to keep emotions high with silly anecdotes and cherry-picked data points. And guys, we can get out of this together, and we can create an environment that has so much light in it that we can't have a shadow pandemic, and there's so much support and love and care that we get out of this together, and then we walk into, late 2021, early 2022, happy, healthy, and being nice. And that's really important. So if you got all the way to the end, thanks very much. Reach out to some people, tell them you love them, tell them you care. If you've got a little bit of extra bandwidth to help, go and help some people. If you need a little bit, lean on some people or ask for help. And as always, just be nice.